Good morning, ladies and gentlemen. This is Aisha Shehi from the National Insurance Company Daman, and I am part of the disease management team. Thank you for joining us today in our webinar, Allergies and Respiratory Health. Allergies are a common condition that can affect people of all ages, often impacting the respiratory system. These reactions can affect breathing and cause discomfort. In this session, we will help you better understand allergies and their effects. Now, please join me in welcoming our speaker, Dr. Amithash Marulaiah, Specialist Pulmonologist at NMC. Dr. Amitash's area of expertise include asthma, tuberculosis, COPD, and advanced diagnostic procedures. Please note that you can send your questions through the Q&A chat box anytime during the sessions, and we will allocate 15 minutes at the end to answer your questions. Dr. Amithash, welcome. The floor is yours.
Thank you, Isha. Thank you so much. Let's begin with the sessions. Good morning, everyone. Myself, Dr. Amithash. I'm a specialist pulmonologist here at NMC Specialty Hospital, Abu Dhabi. Next slide, please. Before I start off with today's session, I have a few disclaimers. I have no conflict of interest. The most of the presentation content of today's topic, today's discussion was chosen from the standard practice guidelines. There's a body called GINA, the Global Initiative for Asthma. This is the body of experts who do sit in some parts of the year. They take the expert advice, they take the recent guidelines, they take the advancement in the literature with regard to asthma, and they formulate certain guidelines, they formulate certain handouts on easy to manage the things, and they circulate all these things free for the entire fraternity of the medical. So based on these guidelines, I have taken some points out of it and some of the patient education articles, such as the British Medical Journal and the American Thoracic Society as well. What I want to stress upon here is this is the generalized contents, and the application of the same to each individual settings within your home or within your environment needs to be discussed with your physician. My sincere attempt to my audience today who are listening to me is to understand the basics of allergy and respiratory health, to answer majority of the common queries we do face being a pulmonologist, being an allergy specialist in day-to-day practice. Next slide, please. So I have just split my content to the following headings. I'm going to introduce with the burden of the breath, the burden of the respiratory illness. I may not concentrate on the factual figures. These are available easily in the internet. I'm just going to stress upon why this allergies, why this asthma is increasing in the environment. I'm going to stress upon a few of the triggers which are invisible to the naked eyes, but still they cause a lot of burden with regard to allergies concern. How we can make the changes within our own environment, within the indoor setting, within the outdoor setting, how we can create the boundaries so that the exposure to these allergens, though it is practically impossible to avoid the exposure, but we can make them less exposure and all those stuff. And the basic aspects of the treatment part of the allergies and the asthma. Some of you may be already suffering from the allergic asthma part. So just a specific content on this allergic asthma and care, and the basics of lung health, how we can maintain. The lot of questions will be there, I understand. So I'll be dealing with these questions in the majority of time. Around 30 to 35 minutes, I'll complete my sessions, and I'm going to give a lot of importance to the questions per se. Next slide, please. So this allergy and asthma, they usually contribute to something called a non-communicable diseases. This non-communicable disease pattern is spearheaded by something called diabetes, which is coming up in a big way everywhere. Then there are cancers and there are various cardiovascular diseases. The major chunk of this even is contributed by the respiratory illness such as allergic rhinitis and asthma. And owing to the changes which is happening in the environment, the air pollution, the urbanization, the climatic change, the global changes, this allergic and asthma are increasing every year, day by day, and we are exposed to a lot of stuff because of the environmental changes. Next slide, please. Why these allergies and asthma are rising? There is something called a hygiene hypothesis. This has been going through decades. This is one of the most versatile, but it's most of the controversial things are there in this hygiene hypothesis. Growing up in a highly sanitized urbanized environments means our immune systems are not exposed to these microbes and the parasites in the earlier ages. We do want to ourselves get exposed to these microbes or parasites. And most of these microbes and parasites come together with these pollen, dust mites, which are otherwise harmless substances. When we get exposed to these kind of stuff very early in our age, the immune regulation, the modulation of the immunity as they're developing will develop in a proper way. That's what this hygiene hypothesis means. Recently, I read an article. I'm not able to recollect whether it was from Singapore or Japan or Korea. In the parks and the play areas of the children and the kids, instead of the mats, they have started putting the fine gravel. They started putting the soil and all. And as per their analysis, over a period of 6 months and 12 months, the burden of the allergic rhinitis and the asthma in children has come down significantly with this small change. So whenever we are not exposed to these microbes and parasite in our earlier age group, whenever we are exposed to this in the later adulthood or in the later age group, the immunity will not know how to respond to this. So they respond in a misdirected, rather aggressive manner to these harmless substances. This allergent asthma, what we have to understand, this is not a pattern of low immunity. This is a pattern of something called the hyperimmunity or the exaggerated response, dysregulated response rather to the substances. So majority of these things come along with something called the environmental pollution or the climate change. For example, the air pollution, the rising carbon dioxide levels, rising nitrogen dioxide levels, rising ozone levels, extreme weather conditions like wildfires, thunderstorms. These even increase the exposure to respiratory irritants. They irritate the airway, make the airways more prone to these kind of things. And a lot of things are going on with regard to studies with regard to gut bacteria, because this immune modulation majority takes place in our gut bacteria. Early use of antibiotics in the increased use in the pediatric age group, or painkillers medicines such as acetaminophen, which are rather anti-inflammatory molecules, coupled with the processed foods and westernized diets, these alter the gut bacteria and increase their susceptibility to immune dysregulation. So this is not in a nutshell. This is something called a complex network. Majority of this contribute by virtue of their own understanding. So altogether, we are getting more exposed to these kind of allergens because of the changes in the lifestyle modifications. Next slide. And the changes in the climate influences the human health in several ways. For example, I basically come from India, and we have majority of Southeast Asians. We are having our childhood in the different environment. Suppose because of the job changes, because of the various reasons, we come out to this part of the country where there are a lot of extreme weather variations. So the way we have developed there is a different, the way we come here is a different. And we come here, we make our living, and our children are born here, and later in their life, they get shifted to the other place. So because of the ongoing globalization, these kind of situations are practically possible in every home and every settings. So extreme weather conditions such as heat and drought, heavy rainfall, flooding, cyclones, these impact the natural ecosystems. We do, being human beings, we have to live with the ecological variations. There are a lot of species migration, distribution patterns, and though the respiratory illness are a separate entity, these again coexist with some of the foodborne diseases, waterborne diseases, vector-borne diseases. So all this kind of stuff will influence the respiratory health in various ways. And the risk factors, as again, occupation agents. Most of the patients will do consider like they are exposed to these allergens only outside. This is wrong. There are a lot of things which happen indoor where we spend a lot of time of a day. Indoor pollution because of cooking fuel, tobacco smoking, maybe because of the molds and other pollutants, our AC, whatever we are breathing, it may not be properly filtered. All this kind of stuff will again contribute to this allergy burden. Next slide, please. So there is something called a unified airway hypothesis. As in most of the patients, they do complain like, doctor, this may not be allergy. This is a nasal symptom which is not going away easily. So this is what we have to understand. This is called a unified airway hypothesis. Allergy and the asthma, these often coexist. The upper airway, the respiratory tracts, which start from the nose up to the lowest part of the lungs where the gas exchange takes place, this form a single continuous organ system because they share the same lining, they share the same immune responses, and these are interconnected. So I do teach my patients the allergic rhinitis and the asthma are the two ends of a spectrum. Most of the times, most of the patients will fall somewhere in between. They're either inclined towards allergic rhinitis or they're inclined towards asthma. They're always somewhere in between. If one is not controlled in an effective manner, we do see patients land up in the severe asthma attacks. So it is a one airway, one disease concept. Allergic rhinitis, chronic sinusitis, hay fever, asthma, and sometimes urticaria even. All these things are the various manifestations of same systemic inflammatory process. Next slide, please. So they even share the same immunology, the way they react to the allergens, the type 2 inflammatory response reacting to allergens. The detailed explanation of these inflammatory response is beyond the scope of today's session, but we have to understand these are coexisting. This has to be controlled effectively, and this has to be monitored in a similar manner. Next slide. So we do understand we have a holistic multidisciplinary approach. Over a period of time, we even accumulated this in our practices as well. The allergic specialist, the pulmonologist, the ENT specialist, we look the entire respiratory tract as a single entity rather than isolated symptoms. So when we try to make our patient understand this aspect, they again ask why you are referring me to ENT specialist, why you are referring me to the skin specialist. This we have to understand, make the patient understand this is the these are not isolated symptoms, these are coexisting, and this has to be taken care of as a single entity. So diagnosing and treating the nasal inflammation is now considered a vital part in managing the asthma pattern. Next slide, please. So basically, decades back, the idea was to survive from the symptoms, but nowadays we do inculcating our own daily practice. We have to proactively manage them. We do have to make the patients understand like this requires follow, this requires the continuation of medicines even the symptoms are not there, so that they will not fall into this attack pattern or fall into this trap of allergy burden again and again. So early detection, the symptoms and signs and the medications are same for each and every patient. Each and every patient have their own pattern. This is something called phenotyping. Again, it depends upon the genetic makeup of the patient. Earmarking the possible allergen help them to understand whether it is an indoor allergen or an outdoor allergen. Unified concept with holistic care, assessing the burden, helping them use the various parameters, and appropriate management to the follow-up care. This is the goal of therapy. Again, we are going to deal with this kind of things again in the due course of the presentation. Next slide, please. So let us understand what are the triggers, what are these components of this allergens, air allergens basically. So the most common air allergens are the dust mites, the pollens, the mold, the pet, and certain environmental factors also contribute to this allergen burden, the air quality, the humidity level, the strong odors, the dust and smoke. Let us try to understand more into this aspect. One special entity here is most of the patients usually develop these kind of symptoms over a period of 2 to 3 weeks. They will ignore the initial symptoms. They will ignore the initial exposure to these basic allergens. They tell, maybe I'm not exposed. I have not gone anywhere outside. I have not done any travel. No, nobody came from outside. I'm not basically a person who has allergic tendency, but still I'm experiencing these symptoms of asthma or wheezing or bronchitis or shortness of breath. This is because they experience symptoms only after the total allergen, the histamine load exceeds their body capacity. Day in and day out, we are exposed to this lot of allergens or day-to-day journey. Maybe we are exposed in the outside environment, maybe in the office setting, we're exposed to passive smoking, all this stuff. So as long as it doesn't overflow, we remain symptom-free. Next slide, please. So there are a lot of fillers, the unavoidable daily exposures, pollens, danders, dust mite food, and other things, which keep on adding this allergen burden to the bucket of allergy. Once the total load increases, once the bucket reaches to the load reaches the brim of the bucket, when the threshold is crossed, then the body reacts with classical symptoms. It may be a minor symptoms like sneezing or rhinitis or nose block. It may be sometimes the urticaria or the skin itching. It may be maybe digestive distress like loose stools and all. It may be a severe symptoms like breathlessness, shortness of breath, wheezing, emergency setting. So we do have to make sure pinpoint like in the initial phase, whenever they're getting exposed to allergens, they have to come to the healthcare practitioner. They have to discuss with them if they have allergic tendency, so they can avoid the severe symptoms. They can avoid this the total load crossing the limits. Next slide, please. So there are certain secondary stress factors which again sabotage this whole allergy pattern. Stress and fatigue. all of us are into this vicious cycle of stress and fatigue. Weather and temperature changes, certain infections, most common are the viral infection whenever we're exposed to flu infection, whenever the schools shut down and start again, the pediatric age group is exposed, they carry the viruses to home, the elderly age group population, the travel, all this stuff. The high histamine in foods, for example, the fermented foods, the cheese, and the dairy products. So all this again contribute to this allergy burden. Next slide, please. So how the air pollution and how the humidity level make changes in this allergen burden. There are certain pollutants like ozone, the nitrogen dioxide. What these kind of pollutants will make is these make the nascent particles, these make not so harmful particles such as the pollens damage, they get damaged to the outer shells. So instead of releasing this allergy in a regulated manner, these pollen grains will get highly activated. They release the highly allergic proteins into the air and they make these particles break down into very small and fine particles. So they get trapped in the lowest part of the lungs. Our nasal cavity, our nasal hairs, the nasal mucosa, all these things are very formally developed, very mechanically developed to trap the larger particles. But when these particles are broken down into the smaller ones, especially when there are particulate matter like PM2.5, PM10, this again has make them as the carriers for the allergens like the mold, the dust mites, the pollens. So they get travel deeper into the lungs, deeper into the airways, the lowest part of the airways, and they generate a lot of airway inflammation, irritation, which presents as asthma. So we have to make sure like we wear the mask and we have to go through the protocols, whatever the authorities are releasing to avoid this kind of exposure to the particles whenever there is high pollution, whenever there is a smoke, and whenever there is a weather changes, thunderstorms or wildfires or something like that. So breathing in this polluted air causes the immune system to become hyperreactive. The nasal passages, lungs get irritated and become far more sensitive. And these allergens, the pollutants act as a carrier to carry to the lowest part of the lungs. Next slide, please. The important the pollutants to watch again along with the nitrogen dioxide, the ozone and the diesel exhaust particles. The ozone especially has a very high tendency to inflame the respiratory tract. Next slide, please. And regarding the humidity level, this is one of the most common question which we encounter nowadays because there are a lot of humidifiers, there are a lot of air purifiers. How about the air conditioners? Or how can we maintain this at our home setting? Let us understand how the humidity levels and the air quality affect the allergen levels. In case of high humidity, the pollens, basically the fungal and the mold spores, these do not drink water. They absorb the moisture for their living pattern. So moisture in the air creates an ideal environment for these biological pollutants, and they thrive in these damp spaces. In certain areas where there are low humidity, for example, the washrooms, whatever we use on our homes, has a tendency to get high humidity, whereas the living rooms and the bedrooms, because of the constant circulation with the AC, these will fall into the trap of low humidity levels. So the low humidity again dries out the nasal passages, dries out the throats, reducing the natural mucus defenses and makes the airway sensitive. So day in and day out, we'll be going to this high humidity, low humidity levels within our home environment. We'll be transversing these environments in the various workspaces as well. So we're exposed to both the kind of things. Next slide, please. So while the humidifiers can help in the living rooms and the rooms where we take rest in the bedrooms and all, they can help ease the dry and congested airways. But again, we should not exceed the limits of 50 or 60%, whatever the literature mentions. The air purifiers, they do help in filtering out the physical allergens, but neither replaces the need for the moisture control. The air conditioner, again, yes, the air circulation will help us to breathe better. But again, if the air vents are poorly maintained, and again, these decrease the indoor humidity, make them blow dry, the air itself, quality itself is bad enough to irritate the airways. So all these things requires a combination. Some areas may require a dehumidification, some areas may require a humidification. And the best natural way is the cross ventilation, which most of the times it's practically impossible sometimes. We will try to understand how we can maintain this. Next slide, please. So how to protect the possible solutions, how to harden the environment where we are staying. So as I told, there are something called IQ Air, the local data, which they release periodically, and a lot of stuffs are available in the social media nowadays. So we can track this data to avoid ourselves getting exposed to these kind of air pollutants, or whenever there's a thunderstorms and all those, some areas may be exposed to a lot of smoke, some industrial areas. HEPA filter, yes, they do help in purifying the allergens. Especially they're very helpful whenever the kids and the older age populations are there. And when we anticipate there is no cross ventilation, there is no balconies, there is no way we can open our windows for the circulation of air. We can use where we spend a lot of time, for example, the bedrooms and the living rooms. Maintain the AC system in a proper way, clean the AC vents periodically, monitor the levels. If possible, if feasible, the digital hygrometer will try to track the indoor humidity levels. Ideal is 30 to 50% and sometimes 30 to 60%. Use a dehumidifier in the naturally damp areas like bathrooms, basements, and kitchens, especially in the kitchen areas where we spend a lot of time over there. In the areas where there are low humidity, especially when the airways get dried a lot, and the most natural phenomena which we can keep ourselves airways not to get dried is keep on hydrating ourselves. Because in the AC environment, we get dehydrated very fast. We'll not be able to anticipate that thing. So let us get more hydration done so that we'll be able to maintain the airways in a not so dry manner. Next slide, please. The indoor air spaces allow them to get natural ventilation, especially during the dry and the low pollen parts of the day. There are some literature, though this is controversial in the situation like the Middle East, where we are exposed to a lot of variations in day-to-day temperature. Especially what they tell is the late afternoons and the early evenings, these are the low pollen parts of the day. Whenever we get up in the morning, early morning, the pollens which are there in the plants and the and the out of circulation within the air, which are in the breathable air pattern. So again, when the sun rises a lot, maybe around 10 to 12 o'clock and all, because of the air circulation, because of the extreme heat, these are again carried out to the environment, and these are in the air what we breathe. So better to avoid these kind of timings. In the late afternoon, in the early evening part, they get settled down to the ground. So it's a proper time to take a stroll or a walk to get some fresh air and breathing it. Again, the overnight, because of the lower temperature, again, because of the breeze and all, they get carried away from the ground to the, again, the breathable air. So the late afternoon and the early evening, these are the preferred timings. It may vary day to day, but still these are the possible situations where we can go out a bit to get a cross ventilation, open our windows, open our doors to get the fresh air inside. So lifestyle adjustments, sunlight exposures, timing the outdoor activities. Most important thing is the bedding hygiene, the anti-allergy covers. Preferably, we do suggest, doctors suggest a lot of to use the cotton stuff rather than the woolen and the other parts, because it's very easy to clean the cotton stuff compared to the woolen thing. And the most common thing which we can do ourselves in home is a little bit of high temperature washing. If your washing machines and the dryers are not allowing this aspect, once everything is done, you can just soak your clothing in a bucket of a little bit lukewarm hot water and rinse it and dry it to enough in the sunlight or in the air drying. So this again washes out most of the allergens which we do encounter, because we wear those stuffs and we'll be constantly breathing the all through the day. So these kind of stuffs we can just make within our own environment, try to make the proper adjustments. Next slide, please. So coming to the basic aspects of the treatment, the three-pillared approach, it's a very good time we are discussing this topic because the May 5th was the World Asthma Day, and what they have encountered the theme as access to the anti-inflammatory agents for everyone with asthma. The patients are worried about certain things called steroids. Since asthma is a hyperinflammatory response, the anti-inflammatory medications are the treatment for the allergic rhinitis and asthma. So the nasal steroids and the steroid inhalers, these are the treatments. So we have to make our patients understand. They may be using something called Ventolin, they may be using aspirin a lot. This again may not change the disease pattern, this make the disease worse. They may be getting a partial relief, but they may not be getting a better response. So we have to make them understand these are the local steroids which acts in the airways and the nasal tract. This will not have a systemic side effects, and they should not be worried about the steroid intake. So the rescue inhalers, immediate relief of the acute symptoms, bronchodilators, antihistamines. We have to keep on consistently telling them we have to continue the maintenance medications to suppress the underlying inflammation. And there are certain things which are advanced things which are coming up in the market nowadays called the biological medications, which do help for the patients who are not controlled with the basic stuff. And there are specific immunotherapy or the desensitization therapies for patients who are having specific confirmed persistent allergies. The detailed explanation again beyond the scope of today's session. So these are the tailor-made things. Each and every patient has their own pattern. So talk to and discuss with your healthcare practitioners that help you out with this kind of symptoms. My only point to stress upon is not to get worried about the steroid intake. Next slide, please. So the key takeaways of today's the basic session is not one thing fits everyone. Everyone has their own pattern. Some people may be having the hardest times. Majority of the times it's in the winter season, but they do have some patients who are having the hardest breathing time in the extreme summers or the spring season, where the summer to the winter to the summer transition is there. Make sure you pinpoint or earmark the common culprit, whether it is an indoor or outdoor population, whether it is in the workspace setting. As I told, the most common myth is like, I don't have allergies. It's just a cold that never is. Whenever a common cold, usually a common cold or a flu should not extend more than 7 to 10 days. It's a common thing what we understand by basic medical science. If it's a viral infection, irrespective whether you get the treatment or not, it's a viral flu or the common flu, it should not go beyond 10 to 12 days. So if it is going beyond 15 days, it is going beyond 3 weeks, then there is some irritation in your airways, which is causing this nagging symptoms. You have to come to a healthcare practitioner. There are a lot of breathing techniques, diaphragmatic exercises, something called pranayama, all this stuff available in YouTube. These will help us to take care of our reserve capacity in the lungs. Try to practice this stuff. So whenever there's an attack of allergy or attack of asthma, your lungs will come into your rescue. The areas of your house which there are low humidity, high humidity areas, make sure you mark these areas and try to make the adjustments within the setting. Opportunity for cross ventilation, go out in the low pollen times of the day, and try to make small changes. Start off with the small changes which may not alter the whole pattern of your living, but still which will help you in the asthma. You can change just after listening to the entire topic, maybe one thing today night at your home, which will help you to make changes in future as well. Next slide, please. So, short discussion of allergic asthma and how we can go for this care. Again, the repetition of whatever we have discussed, just for the any of the people who are non-allergic asthma who are listening to this today's session. Next slide, please. So again, the what I tell is the one airway concept. We cannot isolate the nasal allergic rhinitis from the asthma point of view. They do often coexist, and we have to treat both. The early phase, the immediate twitch phase, and the immediate rhinitis or the bronchospasm phase. But again, it is nagging, where the patients usually ignore this late lingering nagging phase, where the mucus production goes for a lot of time. So we have to understand there are two phases of it. There is no clear demarcation like first few days are early, last few days are late, something like that. It's a continuum of the spectrum. So earlier we make sure that we get the medicines or the proper care. It may not go to the severe episodes in the later stage. Next slide, please. So there are certain diagnostics tools like spirometry, what we do in the OPD setting. We do assess the lung function testing. We do assess the reversibility and the medications. There is one beautiful entity called phenofractional external nitric oxide, which will show the allergic inflammation, the reactiveness of the airway. And we can encourage our patients to use something called peak flow meter, which can be done in an office setting, which can be done in the home setting. So they will know their personal best. And whenever they have an exacerbation, whenever they are confused whether it is exacerbation or not, so they can use this peak flow meter to assess their symptoms and reach out the healthcare setting. Not to overlook here the history in the examination, even though all these diagnostic tools are normal, we do consider based on the symptoms and signs of the patient, examination of the patient, they do have asthma and allergy symptoms, and sometimes we do treat. The patients start questioning us like, doctor, these reports are normal, like why you want me to take the inhalers? Why you want me to take the nasal sprays? Because sometimes you are symptomatic at home. By the time you reach out to our office or our OPD clinic, the symptoms may have resolved and these reports may become normal. So we do have to understand this is the classical pattern of asthma, the variation in the day-to-day symptoms. So we have to make sure you get the proper treatment. Next slide, please. So the asthma action plan, you can just simulate it to a traffic light system. So you have to continue the maintenance medicines as long as your healthcare practitioner advises to prevent the attacks. Even though you're continuing the maintenance symptoms, you have to step up the treatment sometimes at the early onset of the severe symptoms. And whenever there is an emergency, we should always have an asthma action plan, which are the emergencies. There is something called the weekly. Suppose in a week or 2 or 3 nights, you're having the acute symptoms. You're not been able to carry out your day-to-day activities in a proper way. Even the small activities like going to washrooms or the 1 or 2 flights of stairs is causing you breathlessness. And the most important things, these medicines like the nasal steroids and the steroid inhalers do have a proper technique. Each and every device has the technique on their own. Most of the times in a busy healthcare setting, we do make mistake. We don't teach the patients how to take this inhaler, and they have been taking the medicines, but not in a proper way. They get deposit in their mouth, they get deposit in nasal cavity. They don't go to the area where they have to act sometimes. So we do see patients who are supposed to take inhalers, they're taking through the nasal cavity, or supposed to take nasal space, they're taking through the mouth. So all these stuffs are there. So there are some beautiful YouTube videos, even though sometimes we may forget, but go back, it's your own medicine, figure it out, brainstorm, see the technique and take it in a proper way. Next slide, please. So the respiratory care and habits, as we discussed, the pulmonary hygiene, the hydration, the precautions, wearing mask, the airway protection, the HEPA standards. In some of the settings where there are a lot of stuff, there is no cross ventilation, these HEPA filters are non-negotiable. But we have to understand these are a part of the disease pattern. This may not replace all the entities. So we have to read these manuals because most of the HEPA filters comes with the area description as well. They may not cover the entire area. If the area is very big, you may require 2 or 3 filters. You may require air purifiers along with the HEPA filters. You may require a proper conditioning of the airways. So discuss with your healthcare experts and discuss with whatever the machine modules are there. And most of the common misunderstandings like vaping is better than smoking. No, a gentle firm point is both of these are irritants to your airways. Both of these are insult to your airways, making the allergic reactions more severe. And they do carry some danger, like they're causing something called COPD, which is a non-reversible entity of the lung issues. And they do contain a lot of cancer-causing agents. So none of this is safe. Both are same with regard to the healthcare point of view. Smoking is bad, vaping is also bad. Next slide, please. So the pro tips, most of the times the attacks of the asthma do happen at night time, somewhere around 2 o'clock to 4 o'clock in the early morning hours. Sometimes patient think this is only a cough, it is causing my airways dry because of the AC environment, because of the weather changes. These are the light bulb movements which require care with regard to healthcare practitioners, because once we avoid the second night and third night, they may land up in severe exacerbations. There are a lot of comorbid conditions, especially the gastroesophageal reflux disease, which will irritate the throat, it will irritate the, make the throat more dry and make it more irritant. There are certain cardiac comorbid conditions which make your lung wet and a lot of mucus production, which will again exacerbate your asthma. Certain medications which are taken for some other illness, for example, the beta blockers which are taken for hypertension or cardiac illness, they do have some tendency to cause bronchospasm or wheezing or breathlessness. So whenever you're confused, discuss with your healthcare practitioners, open up to them with all the various health issues what you have, so that they will be acting upon it in the very first instant. So there is an analogy of something called a sunscreen versus aloe vera. So before you get the sunburn, before you get the attacks, it's always better to apply the sunscreen. So go for maintenance therapy, go for rescue inhalers before you get the attacks. So don't forget to follow up with the doctor. So make it a part of a daily routine. Next slide, please. So we'll come to the last part of today's session, why lung health is important. As we all know, we breathe oxygen. We take a lot of stuff through the airways. Day in and day out, we breathe involuntarily. Like as I'm speaking, I'm breathing now. As you're listening, you're breathing now. So every organ of the body, every cell of the body require oxygen as nutrition. So good lung health means they'll have more energy for daily activities, more energy for exercises. So healthy lungs are the first defense against various microbial infections, various flus and all. Next slide, please. So the smoking and vaping, again, it causes a lot of irritation. Sometimes we may not be smoking, but we may be going to the circles, the social circles where there are a lot of secondhand smoking happening. So even breathing in such smoke from others can be harmful. Inculcate some regular daily physical activities, aerobic exercises so that your lungs are healthy. You tend to use that reserve capacity. And even these, even short walks and all, which will bring down a lot of stress factors and the fatigue, which will again contribute to the asthma, as I discussed, the substitution factors for the airway allergens. And the most important thing is washing hands, like the way we spent during the COVID times, frequent washing because of the foment infections and all. Droplet precautions, covering yourself while you cough and sneezing. And next slide, please. So the clean environment, breathing exercises, hydration, and the patients, it's very good thing about this part of the world because they do give some influenza vaccinations free of cost for everyone every winter season. We have to make use of this opportunity. We have to get ourselves vaccinated because always precautions, always prevention is better than the cure. So make use of these kind of stuff, whatever the healthcare regularities or healthcare are giving yours to you, and get a benefited out of this. Keep yourself hydrated a lot, making it easier for lungs to clear out the irritants. Do some breathing exercises and discuss with your healthcare practitioners whenever you go for healthcare. We may forget in the first instance, you may forget in the second instance. Try to make them understand the healthcare setting where you are living. What is your home? How it is happening, what is your school environment, how the things are changing over in the workplace, all this. Whenever you open up to them, they will be able to give a better solution, a tailor-made solution to your own healthcare setting. Next slide. So this is all about the basics of the allergy and the respiratory health. I hope I gave some light into this topic, which the people hearing to me can understand. So I thank Daman Basic and the NMC for giving me this opportunity. So the session is open for the questions and think I'm open for discussion. Thank you.
Thank you, Dr. Amithash, for the informative presentation on understanding allergies and respiratory conditions. Now we will move on to our Q&A session. So first, Doctor, first question we have, what's the difference between seasonal allergies and the early signs of a chronic respiratory condition?
Yes, a good question rather. Most of this pattern, like when we differentiate these allergies and asthma, also we do have some certain entities. We do have certain groups like the intermittent asthma or the intermittent allergies and the perennial allergy syndrome. The seasonal allergies usually affect the people who don't have the background of allergic tendencies. It too happens because of the season or the setting where they are having and where they are breathing. Whereas the chronic asthma part is happening whenever there are changes within the childhood pattern, whenever they have allergic tendencies in the familial and genetic pattern. But there is a very blurred line between these two. Even the seasonal allergies, when they are allowed to continue for a long time, when they're ignored, where they're not treated, when they're happening over a period of time, for example, 2 to 3 years, in every seasonal change, every transition of weather, they do have a tendency to go to the chronic allergen pattern. So basically, we have to understand this is the airway pattern, this is the airway disease. Whenever it gets irritated or whenever it gets affected intermittently, we do happen to have this seasonal allergy pattern because of the variations in season, dust exposure, and all. Whenever it happens regularly on without any break in between persistent perennial allergy pattern, then there is a entity called chronic asthma.
Thank you, Doctor, for the detailed explanation. Moving on, Doctor, are children more vulnerable to respiratory allergies than adults?
Sorry, come again.
Are children more vulnerable to respiratory allergies than adults?
There are no guidelines to confirm this point, but again, the children are more prone in symptoms phase because their airways are still growing. Whenever the airways are narrow, whenever the mucus deposition gets affected in the airways which are narrow, they do have a lot of symptoms. But are they really prone for more kind of allergies and asthma? I'm not sure about this point because the immunity is developing, and whenever as I told, the hygiene hypothesis, whatever we want to go, getting them little bit exposure early in the phase may help in long term. That's what I say.
Mhm. Thank you, doctor. And moving on, how can exercise be safely included in the routine of someone with asthma?
Good point. Good question. Yeah, there is some entity called exercise-induced bronchoconstriction. There is some entity called exercise-induced asthma exacerbation. Because whenever we start exercising, our airways will get activated and we do go for some bronchoconstriction by virtue, even though we are a normal person. So whenever the asthmatics start exercising, they do have some acute symptoms. They do have some exacerbation and the breathlessness symptoms. But this is not classically seen in all asthmatics. But if you are a known asthmatic, if you are worried about excess capacity, what I suggest is to go for the gradual increase in the excess capacity. There's something called endurance, which you have to build upon over a period of time. And gradually you have to, for example, once you start with the aerobic exercises, there are a lot of stuff which are available with the AI tools and all, which can help you like at what level you are breathing, the VO to max things, and the saturation measures and all. And I do suggest whenever you're working in a setting like a gym or a area where you're working out, do have this inhaler with you for emergency usage, the rescue inhalers, which can come handy if there are the limits which are crossing and we are having the symptoms phase. But over a period of time, once they start practicing the exercises, especially the swimming part, if you are happen to swimming in a very hygienic environment, it do helps in asthma control because you are going to have some prolonged breaths during the swimming pattern, which do help in your making out your respiratory, increasing the reserve capacities as well. So over a period of time, you will be a controlled asthmatic rather than uncontrolled. So it should not, asthma per se should not make you to avoid to do exercises. We do advocate all our asthmatic patients to go for mild to moderate exercise as long their capacity holds on, gradually increasing the tendency to exercise over a period of few weeks to few months, and go for activities like aerobic exercises, brisk walking, swimming, all this kind of stuff.
Thank you, doctor. And moving on, doctor, to nutrition and allergies. So, are food allergies connected to respiratory allergies in any way?
Sorry.
Are food allergies connected to respiratory allergies in any way?
We do have to understand certain things here. And there are certain different aspects such as the food allergens per se, the food sensitivity per se, and the allergy pattern. There are certain food allergens. For example, certain patients of mine has seafood allergy. If they are taking the seafoods, especially the raw seafoods, which are not cooked, which are not baked, because of being rich in the protein. The basic allergens, most of the allergens are the protein products. So they are exposed suddenly to this kind of things, and they have something called the lip swelling. They have some edema in the larynx. They go for acute bronchospasms. They do have ended up in emergencies. They do have ended up in something called the tracheostomies, or they are required the ventilatory support and all. There are certain things called the food sensitivities. This is most common what we see in our allergy patients, which we advise tell them to avoid. For example, excessive temperature, like cold foodstuff on a regular basis or too hot on a regular basis. The foodstuffs which are causing the gastric irritants, such as the citrus fruit or the lime fruits, or the lot of which cause the acidity increase, which they do have a tendency to gastro reflux disease, because these will keep the airway dry. Even though they give a experience of soothing whenever they take it, over a period of time they cause the airways to get more dry. So if you have a specific food allergy, if you have taken a food and you develop the rashes all over your body, if you have developed the lip swelling and your facial edema and you have got into acute bronchospasm, yes, that is a food allergy. This is a very serious issue. You have to discuss with your healthcare expert to avoid this kind of stuff. There are some skin prick allergies and there are blood allergen testing which are done in the advanced care setting, which can pinpoint the particular allergy pattern for you. And here I put a small note over there in my slides about the immunotherapy. This immunotherapy are tailor-made for these kind of stuff. Whenever there is a persistent food allergy, giving this the allergens in a low dose manner will try to induce some sort of desensitization or some sort of tolerance to your body so that you can avoid these severe allergic reactions. The food sensitives are the common thing. We will not be able to pinpoint a particular foodstuff in this kind of situation. So we generally, as a blanket advice, we tell the patients to avoid excessive cold, the citrus fruits and the lime fruits, and which cause the gastritis. Hope I gave some light about the question.
Thank you, Doctor, for the detailed explanation. Doctor, we also have a question. What are the most effective ways to improve indoor air quality?
Yeah, as I discussed the detail in my slides as well, it all depends upon the setting where exactly you are having that. The most common things what we do is like while beautifying the environment, whatever we have, we use a lot of mats, we use a lot of stuffs, especially when the kids are there. A lot of these kind of dolls, the woolen things, and a lot of being used. These will trap these molds, these will trap these airway pollutants, and they will get trapped in a longer extent. Even especially the sofas or the sittings or the furnitures, whatever we're using, if they're made up of some material which can trap the air for a long time. So we do breathe a lot on this environment. We do sit on them, we do sleep on them, and we inhale a lot of, we breathe a lot of this environment. So based on their healthcare settings, definitely the HEPA filters, definitely the air purifiers will help. Again, they come with a constraint of the areas where we are using. So along with the combination of the air circulation with the air conditioner, the ideal temperature being around 23 to 25, which is within the breathable suggestions. So it again depends upon the weather what we are having sometimes. So it should not get too much dry and it should not get breathing. And the old traditional methods of mopping with water and having the dampness removed by the air and frequently cleaning the areas and cross ventilation. So it's a combination per se. It may not be a single entity what we have to take care here based on the healthcare settings. So as much as possible, try to keep the areas clean, try to areas not so damp, especially the walls and all. And whenever the situation permits, using these HEPA filters and the air purifiers are beneficial. Especially, I suggest whenever there are babies in the elderly population, in the areas of like living rooms and the bedrooms, this will help in a larger extent.
Thank you, Doctor, for the detailed explanation. With that, we will wrap up our Q&A session. Thank you once again, Dr. Amithash, for sharing your expertise and valuable insights on such important topic.
Thank you so much. Thank you. Yeah.
And to our audience, we have now reached the end of our webinar. Thank you for joining us and participating. Please take a moment to answer the survey questions. Your feedback and input is appreciated. Thank you once again, and we look forward to seeing you all again at our upcoming webinars. Stay
Thank
safe
you.
and enjoy the rest of the day.